The first hour after you wake up can reveal more about your health than almost any other part of the day. Before breakfast, before coffee, before your medicines have fully taken effect, your body is already giving you information. Maybe it takes longer to sit up than it did last year. Maybe your hands feel unusually stiff. Maybe your legs feel weak during the first few steps. Maybe you wake tired even after spending 8 hours in bed. Or perhaps your mind feels cloudy, your heart flutters, or the short walk to the bathroom leaves you breathing harder than expected. Most people dismiss these changes with one sentence: "I am just getting older." But that sentence can hide problems that may be treatable. I am Dr. Daniel Brooks, and today I want to show you 9 morning signs that may suggest your body is aging faster than expected after 70. Some are common and harmless. Some deserve a conversation with your doctor, and a few should never be ignored. The goal is not to frighten you. It is to help you notice change early while you still have more choices and more opportunities to protect your independence. Stay with me until the end, because the final sign is not a pain, a number, or a visible symptom. It is a quiet change in daily life that many families miss until an older adult has already lost a great deal of strength and confidence. Let us begin with sign number 9. You wake up tired even after spending enough time in bed. You may sleep 7, 8, or even 9 hours. But when morning comes, you feel as though you barely rested. Your eyelids are heavy. Your body feels drained. Your thinking feels slow. Getting out of bed feels like the first difficult task of the day. A little grogginess is normal. Everyone has mornings when sleep was not perfect, but persistent exhaustion is different. The important question is not whether you feel tired once. The important question is whether you wake tired almost every day. One possible cause is poor sleep quality. You may be in bed for 8 hours without receiving 8 hours of restorative sleep. Sleep apnea is one common reason. With sleep apnea, the airway repeatedly narrows or closes during sleep. Breathing may stop briefly. Oxygen can fall. Then the brain partly wakes you, so breathing can restart. You may never remember these awakenings, but your heart and brain experience every one of them. By morning, you may have a headache. Your mouth may feel dry. You may feel irritable. Your thinking may be slower, and you may become sleepy while reading, watching television, or sitting after lunch. Sleep apnea also matters because it can contribute to high blood pressure, irregular heart rhythms, stroke risk, and poor blood sugar control. Ask yourself a few questions. Do you snore loudly? Has anyone told you that you stop breathing? Do you wake choking or gasping? Do you wake with headaches? Do you feel exhausted after a full night in bed? If several of those are true, speak with your doctor about sleep apnea. Persistent morning tiredness can also come from anemia, low thyroid function, depression, chronic pain, heart disease, kidney problems, medication effects, or vitamin deficiencies. Some allergy pills, sleep aids, pain medicines, and anxiety medicines can leave older adults feeling heavy and confused the next morning. Do not stop any medication on your own. Bring your full medication list to your doctor and ask whether any of them may be affecting your sleep or morning energy. For the next 7 mornings, rate your energy from 1 to 10 before leaving the bed. Also, write down whether you woke during the night, had a headache, felt short of breath, or needed several naps the previous day. Patterns are more useful than memory. And if you want more senior health guidance that helps you recognize quiet warning signs before they become serious, subscribe to the channel now. These videos are made to help you protect your strength, balance, heart, brain, and independence with information you can actually use. Now let us move to sign number 8, morning stiffness that lasts much longer than expected. After 70, a little stiffness is common. Your joints have moved through decades of work. Cartilage changes, muscles tighten while you sleep. The body may need a few minutes to warm up, but how long the stiffness lasts matters. If your hands, knees, shoulders, hips, or back loosen within 20 or 30 minutes of gentle movement, that may be normal age-related stiffness. But stiffness that lasts an hour, 2 hours, or most of the morning may suggest inflammation. This is especially important when it affects both sides of the body, both hands, both shoulders, both hips, or several joints at once. Inflammatory conditions can cause long-lasting morning stiffness. Rheumatoid arthritis is one example. Polymyalgia rheumatica is another condition that can cause severe stiffness and aching in the shoulders and hips. A person may struggle to raise their arms, dress, comb their hair, or stand from a chair. The stiffness may improve later in the day, then return strongly the next morning. That pattern deserves attention. Another warning sign is stiffness combined with swelling, warmth, redness, fever, unexplained weight loss, or severe fatigue. Do not assume every joint problem is simply worn-out cartilage. Different types of arthritis need different treatment. Before standing, try a gentle wake-up routine. Slowly open and close your hands. Circle each ankle. Bend and straighten your knees. Roll your shoulders. Take a few slow breaths. Then sit up gradually. These movements will not cure an inflammatory condition, but they can help your body move from rest into activity. Track how long the stiffness lasts. Do not tell your doctor only that you feel stiff. Say, "My hands remain stiff for nearly 2 hours every morning." That detail gives them much more useful information. Sign number 7 is dizziness when you sit or stand. You wake up, you sit on the edge of the bed, then you stand and the room seems to tilt. Your vision darkens, your legs feel uncertain, you reach for the wall. A few seconds later, everything settles. This is often caused by a temporary drop in blood pressure called orthostatic hypotension. When you stand, gravity pulls blood toward your legs. Your heart and blood vessels must quickly adjust to keep enough blood flowing to the brain. After 70, that adjustment may become slower. Dehydration can make it worse. So can blood pressure medication, water pills, heart medicines, diabetes, anemia, nerve problems, and long periods of bed rest. The greatest danger may not be the dizziness itself. It is the fall that follows. A fall can lead to a broken hip, wrist fracture, head injury, hospitalization, fear of walking, and loss of independence. Use what I call the slow start rule. When you wake, sit on the edge of the bed for a slow count of 10. Move your ankles and feet, then stand while holding something stable. Wait another 10 seconds before walking. Do not rush into a dark bathroom. Use night lights. Keep loose rugs away from the path. Place your glasses, cane, or walker within reach before you sleep. If dizziness happens repeatedly, ask your doctor to check your blood pressure while lying down, sitting, and standing. A seated reading can look normal while the standing pressure falls too low. Also notice whether the dizziness began after a new medication or a higher dose. If it comes with chest pain, fainting, new weakness, trouble speaking, severe headache, or loss of coordination, seek urgent medical help. Now, sign number 6 is one families often overlook. Morning confusion or mental fog that lasts longer than expected. Almost everyone needs a few minutes to feel fully awake. That is normal, but if it takes 30 minutes, an hour, or longer to know what day it is, remember the morning plan, follow a conversation, or feel mentally present. It deserves attention. This does not automatically mean dementia. Many treatable problems can create morning confusion. Poor sleep, sleep apnea, low blood sugar, high blood sugar, dehydration, medication side effects, vitamin B12 deficiency, low thyroid function, depression, infection, low oxygen, hearing loss, or vision problems. Pay attention to whether the mental fog is getting longer. Is the person repeating the same question? Are familiar routines becoming difficult? Are they confused only for a few minutes or throughout the day? Can they still manage medication, money, cooking, appointments, and transportation safely? A sudden change is especially important. If an older adult becomes abruptly confused, unusually sleepy, restless, agitated, or disoriented, seek medical advice promptly. Sudden confusion can come from infection, medication problems, dehydration, low oxygen, stroke, or another urgent condition. Do not call sudden confusion normal aging. A calm morning routine may help. Open the curtains, put on glasses and hearing aids, offer water if there is no fluid restriction. Remind the person of the date and the morning plan. Avoid loud television or several people talking at once. Give the brain a gentle start. But if changes persist or worsen, speak with a healthcare professional. If this information is helping you recognize symptoms you may have been dismissing, subscribe to the channel. Many health problems after 70 begin with small clues, and the goal here is to help you notice them before months or years pass. Sign number 5 is a heartbeat that feels different in the morning. Maybe it flutters, maybe it skips, maybe it races, maybe it feels irregular, almost like a fish moving inside the chest. Occasional awareness of the heartbeat can happen with stress, caffeine, dehydration, anxiety, fever, alcohol, or poor sleep. But a repeated irregular rhythm should not be ignored. Atrial fibrillation becomes more common with age. In atrial fibrillation, the upper chambers of the heart beat in a disorganized way. Some people feel strong palpitations. Others feel tired, weak, dizzy, or short of breath. Some notice only a slightly irregular pulse, and some feel nothing at all. The reason this rhythm matters is that blood can pool inside the heart and form a clot. If that clot travels to the brain, it can cause a stroke. You do not need to become anxious over every extra beat, but become familiar with your normal rhythm. Sit quietly. Place 2 fingers on the thumb side of your wrist. Do not use your thumb. Feel the pulse. Does it seem steady? Does it seem extremely fast? Does it feel randomly irregular? A smartwatch may sometimes detect an unusual rhythm, but it cannot replace a medical test. If you repeatedly notice an irregular pulse, tell your doctor. They may recommend an electrocardiogram or a heart monitor. Pay attention to what happens with the palpitations. Do they follow caffeine, alcohol, poor sleep, dehydration? Do they last seconds, minutes, or hours? Seek urgent help if palpitations come with chest pressure, fainting, severe breathlessness, weakness on one side, or difficulty speaking. Sign number 4 is a change in morning bathroom habits. This is a subject many people avoid because they feel embarrassed. But bowel and bladder changes are valuable medical information. Constipation becomes more common with age. The bowel may move more slowly. People may drink less water. They may move less. Medicines such as opioid pain pills, iron, calcium, antidepressants, and some blood pressure medicines can also slow digestion. A day or two of change may not mean anything serious, but a sudden or persistent change deserves attention. Watch for blood in the stool, black tar-like stool, a major change in stool shape, constipation that keeps returning, persistent diarrhea, abdominal pain, unexplained weight loss, or the feeling that the bowel never empties fully. Also pay attention to watery leakage in someone who has been constipated. Sometimes liquid stool can leak around a hard blockage and be mistaken for diarrhea. Urination also gives useful information. Men may notice a weaker stream, trouble starting, dribbling, or frequent nighttime urination because of prostate enlargement. Women may notice urgency, leakage, burning, or repeated infections. Some changes are common and manageable, but blood in the urine, inability to urinate, severe pain, fever, or sudden loss of bladder control should not be ignored. A simple morning habit is drinking water before coffee, unless your doctor has restricted fluids. The body loses water overnight through breathing and urination. A glass of water may support hydration and bowel movement. Fiber can help prevent constipation, but increase it gradually and drink enough fluid. Suddenly adding large amounts of dry fiber without water can worsen bloating and constipation. Gentle walking also supports bowel function. Even 5 or 10 minutes after breakfast may help. Never let embarrassment stop you from mentioning a bowel or bladder change. Doctors and nurses discuss these concerns every day. Now, sign number 3 is a visible change in your skin, nails, eyes, feet, or face. Most people glance in the mirror without truly looking, but your appearance can offer clues about what is happening inside the body. Skin naturally becomes thinner with age. Bruising may happen more easily because the support around small blood vessels decreases. Vertical nail ridges are also common, but some changes deserve evaluation. A yellow color in the skin or whites of the eyes may suggest a liver or bile problem. Very pale skin may be connected to anemia. Blue lips or fingertips can indicate low oxygen. A new facial droop may be a stroke warning. A wound that heals very slowly may suggest poor circulation, infection, or high blood sugar. A dark line under a nail, especially if it is new or changing, should be examined. Nails that become very brittle, spoon-shaped, thick, or dramatically different may be connected to nutrition, circulation, infection, or another condition. The feet deserve special attention after 70, especially if you have diabetes. Look for redness, blisters, cuts, swelling, dark areas, cracks between the toes, or wounds that are not healing. Nerve damage may reduce pain, so a serious foot problem may not hurt as much as expected. Also watch for unexplained bruising. Blood thinners, aspirin, steroids, and normal age-related skin changes can contribute. But if bruising becomes excessive, appears without a remembered injury, or comes with bleeding from the gums, nose, urine, or stool, contact your doctor. Once a week, look at your face, hands, nails, feet, and lower legs in good light. Do not search for disease. Simply become familiar with what is normal for you. The more familiar you are with your body, the easier it becomes to notice meaningful change. Now we come to sign number 2. Breathlessness with very little morning activity. You get out of bed, you walk to the bathroom. By the time you arrive, you are breathing harder than expected. Or you become winded while dressing, washing, making the bed, or walking to the kitchen. Some reduction in exercise ability can happen with age, but new or worsening breathlessness should not be quietly accepted. It can come from heart disease, heart failure, lung disease, anemia, infection, poor fitness, medication effects, or sleep apnea. Pay attention to how much activity causes it. Last year, could you walk to the mailbox without stopping? Can you still do it now? Can you climb the same number of stairs? Do you need to pause while dressing? Do you become breathless when lying flat? Do you need more pillows than before? Do you wake coughing or gasping? Are your ankles swollen? Have you gained several pounds quickly? Do you feel chest pressure? Those details help a doctor understand the cause. Breathlessness with ankle swelling, rapid weight gain, and difficulty lying flat may suggest fluid buildup or heart failure. Breathlessness with wheezing or a long smoking history may point toward lung disease. Breathlessness with pale skin, weakness, and fatigue may be related to anemia. Morning breathlessness with loud snoring, choking, and headaches may suggest sleep apnea. Sudden severe shortness of breath, especially with chest pain, fainting, sweating, or one painful swollen leg, can be an emergency. Do not wait for the next routine appointment. Call for urgent help. Before we reach the final sign, subscribe to the channel if you want more clear senior health guidance like this. We cover warning signs, medications, foods, circulation problems, balance issues, and daily habits that can protect independence after 70. The final sign is not one symptom, it is a pattern. You are quietly doing less than you used to. Maybe you once walked every morning, now you remain in the chair. Maybe you cooked full meals, now you eat whatever is easiest. Maybe you attended church, met friends, worked in the garden, went shopping, or played with your grandchildren. Now those activities feel like too much effort. Nothing dramatic happened. Life simply became smaller. This may be the most important sign on the list because it often reflects several problems happening together. Poor sleep makes you tired. Pain makes movement uncomfortable. Dizziness makes you afraid. Breathlessness makes activity difficult. Hearing loss makes conversation exhausting. Low mood removes motivation. Weak muscles make every task feel harder. Then you do less. And when you do less, muscles become weaker. Balance worsens. Stamina declines. Confidence falls. The world becomes smaller again. This is how functional decline often happens. Not through one dramatic event, through small retreats repeated over time. One missed walk. One canceled gathering. One meal skipped. 1 week spent mostly in a chair. Then another. But this pattern can sometimes be reversed. The answer is not forcing yourself into a difficult exercise program overnight. The answer is choosing one small activity and rebuilding from there. Walk to the mailbox. Stand during television commercials. Call one friend. Prepare one simple meal. Sit outside for 10 minutes. Perform 5 safe chair stands. Walk through the hallway twice. Ask someone to join you for a short walk. The activity should be small enough that you can repeat it tomorrow. Consistency matters more than intensity. Doing less may also be a sign of depression. Older adults do not always describe depression as sadness. They may say they feel tired. They have lost interest. They do not want to go anywhere. They sleep more. They eat less. They feel like a burden. They stop answering the phone. They stop caring about things they once enjoyed. Grief, loneliness, chronic pain, disability, and health changes can all contribute. This deserves the same respect as a physical symptom. If life has become quieter, smaller, and less meaningful, talk to someone. A doctor, a counselor, a family member, a trusted friend. You do not have to carry it alone. Now, there is a simple way to monitor all 9 signs without becoming overwhelmed. Create a morning health page for 1 week. Write down your energy from 1 to 10. Write down how long stiffness lasts. Note whether you feel dizzy when standing. Note whether your thinking feels clear. Check whether your heartbeat feels familiar. Record any bowel or bladder changes. Notice swelling, wounds, bruising, or changes in your skin and nails. Write down how far you can walk before becoming breathless, and ask whether you are doing less than you did 6 months ago. This is not about judging yourself. It is about creating useful information. A doctor can do far more with a clear 7-day pattern than with the sentence, "I have just felt strange lately." Now let us walk through the signs again. Waking tired despite enough time in bed, stiffness that lasts much longer than expected, repeated dizziness when standing, morning confusion or mental fog that lingers, a new, fast, or irregular heartbeat, a meaningful change in bowel or bladder habits, a new change in the skin, nails, eyes, feet, or healing, unusual breathlessness with small amounts of activity, and quietly doing less than you used to. None of these signs alone proves that your body is aging too quickly, but each one gives you information. And when several appear together, they deserve even more attention. Fatigue plus pale skin plus breathlessness may suggest anemia. Dizziness plus low blood pressure plus a new medication may suggest the dose needs review. Morning headaches plus loud snoring plus exhaustion may suggest sleep apnea. Swollen ankles plus rapid weight gain plus breathlessness may suggest fluid buildup. Long morning stiffness plus swollen joints may suggest inflammation. Bathroom changes plus unexplained weight loss may require investigation. Symptoms form patterns, and patterns guide better medical care. Certain changes should never wait. Sudden weakness or numbness on one side, a drooping face, trouble speaking, severe chest pain, sudden breathlessness, fainting, a new severe headache, heavy bleeding, black stool, vomiting blood, sudden confusion, or an inability to wake normally. These require urgent medical attention. For less urgent but persistent symptoms, make an appointment. And when you go, do not say only, "I am getting older." Say when the problem started. Say how often it happens. Say whether it is becoming worse. Say what makes it better or worse. And say what you can no longer do. "I feel tired" is useful, but "I can no longer walk from the bedroom to the kitchen without sitting down" is clearer. "My joints hurt" is useful, but "My hands remain stiff for 2 hours every morning" tells a stronger story. "My memory is worse" is useful, but "I now forget whether I took my medication several mornings each week" gives your doctor something specific to investigate. Do not minimize your experience. You are not wasting anyone's time. If you have stayed with me this far, subscribe before you leave. Many people watch one useful health video, plan to return, and then never find the channel again. Subscribing means the next important senior health guide can reach you before a problem has been ignored for months. I am Dr. Daniel Brooks, and I want to leave you with this. Aging is not a failure. Your body has carried you through decades of work, responsibility, family, grief, recovery, and change. It deserves patience, but patience does not mean ignoring warning signs. There is a difference between accepting normal aging and surrendering to problems that may be treatable. You do not need to inspect your body with fear every morning. Just notice. How is your energy? How long does the stiffness last? Do you feel steady when you stand? Is your mind clear? Is your heart rhythm familiar? Are your bathroom habits changing? Does your skin look different? Can you walk as far as you could last year? Are you still participating in your own life? Those questions take less than a minute, but the answers may help you recognize change early. Tomorrow morning, before you reach for your phone or turn on the television, pause for 30 seconds. Notice how your body feels. Then choose one small action. Drink water, move your ankles, stand slowly, walk for 5 minutes, call your doctor, write down a symptom, or reach out to someone you have not spoken to recently. Small actions are not meaningless. Repeated every day, they can change the direction of your health. Everything shared here is for general education only and does not replace personal medical care. If you develop chest pain, severe shortness of breath, fainting, stroke symptoms, sudden confusion, heavy bleeding, or another major change in your condition, seek urgent medical help immediately.